Hello radiographers, hope you are doing good. Welcome to the second part of the MRI elbow joint tutorial. This is the T2 transverse fat set and PT fat set transverse is running. So select the T2 transverse series and send to the filming and change the film layout to 5 into 6 so that 30 transverse image fit in this film and keep the reference image in each segment. So this is a T2 transverse film in 5 into 6 layout. That means there is 5 column and 6 rows, and this is the T1 transverse. And checking the T1 transverse images, select series and you can rotate a little bit. I am rotating to the left side and send to the filming, and already the film layout is 5 into 6. Slightly enlarge the images and pan the image. So panning is the move the images and also keep the reference image in each segment. So this is the second transverse film, and now PD fat set transverse is running, and then PD fat set sagittal will scan. So I am repeat and opening the T1 team coronal because PD fat set coronal is not giving fat suppression, homogeneous fat suppression all the place of the image. So that's why I am making a T1 team coronal and repeating this scan. So I am actually making a T1 team transverse protocol because the PD fat set transverse images are not good enough because the fat is not suppressed all the way. You can see also on the sagittal image, PD fat set sagittal, that the fat is not suppressed in all the parts, all the places of the image because of the magnetic field inhomogeneity, because the elbow is not centered at the middle of the magnet. That's why this magnetic field inhomogeneity occurs, this artifact, and that's why I am repeating the T1 team transverse and making them transverse and coronal because the team or STR sequences will gives us a homogeneous fat suppression images. In the coronal and sagittal PD fat set, you can see that the fat is not suppressed at the border of the elbow joint. That's why I am making a sagittal T1 team sagittal and also adjusting the shimming of the sequence, and this shimming will give you a little bit homogeneous magnetic field homogeneity. So shimming is important for these joint cases, and if the body part is not centered with the magnet, because the patient's arms in left side, because this is the left elbow, so the position of the elbow joint a little bit in left comparing to the center of the magnet, and rename the protocol to SES because I am making it from the T1 team coronal, making it sagittal. So this is the planning for T1 team sagittal, and click apply. This is the PD facet transverse that you can see that the fat is not suppressed in all the places. That's why I recreate another protocol that is T1 team transverse. I'm checking the transverse films that I have already made. This is the T1 transverse, adjusting the window, and now T1 team transverse is running. So this is the T1 team transverse sequence, and you checking the images, you can see that this is better comparing to the PD fat set transverse. In this T1 team transverse sequence, you can see that fat is suppressed all the way of the tissues. Because STR or team suppress fats all the way all over the image, but the standard fat set will not suppress fat because of the magnetic field inhomogeneity. So adjust the window, select series and send to filming this T1 team transverse, and the film layout is already selected 5:6. Just zoom in the image and pan a little bit to the left side. So this is the third transverse film that I have prepared for printing. So elbow joint is a long MRI. It takes long time. It takes patience. So that's why I divided this tutorial into 3 segments. This is the second part. It takes almost 40 to 45 minutes to complete this elbow joint because the protocols are scan times are longer, and also I used contrast. In the last segment, we will see the contrast protocols planning and filming. For this elbow joint, I have used a small flexible coil wrap around the elbow joint. So if you have the dedicated elbow joint, elbow coil, it will be better. But if you don't have this dedicated elbow coil, you can use the flexible coils wrapping around the elbow joint. Now T1 team sagittal is running, and then the post contrast protocols, you can see that I have taken 3 standard fat set, coronal, transverse and sagittal. And now I have to push contrast to the patient, and that's why the notification came to confirm the contrast administration, and that's why I have to move out the patient to push contrast. And now planning the post contrast sequence T1 fat set coronal. So for coronal, plan on the sagittal and axial images, and the field of view is 140 and slice thickness is 3. So volume is 10 is the amount of contrast or quantity of contrast. I'm waiting for the contrast is to be pushed. I'm checking that the fat set is selected. You can also select spare. Spare is another fat set technique to suppress fat more strongly. So this is the T1 team sagittal. You can see that the fat is suppressed all the place of the elbow joint. If you look at the subcutaneous fat, that is suppressed, and I also filtered this sagittal image using the manual filtered option. A beautiful sagittal elbow joint you can see, and I'm checking the images. To print this, select series and send to the filming, and now go to filming. And for sagittal I have to choose the layout 5:5, I think. So I choose 5:5, that means there is 25 sagittal elbow joint image and 25 segments in this film. You can see that I have taken the elbow joint with the lower shaft of the humerus as the doctor advised to cover the lower shaft of the humerus. That's why the elbow joint is little bit lower. The contrast is pushed and I move in the patient and then apply the T1 fat set coronal post contrast sequence. So click apply button and click yes. And now it's time to plan T1 fat set transverse post contrast. So this is the transverse positioning block, and angle the positioning block on the sagittal image perpendicular to the elbow joint. So keep all the three plane on the exam segment, sagittal, coronal and axial to plan, and then click apply. And now it's time to plan T1 fat set sagittal post contrast. So increasing the field of view and plan over the axial and coronal image. So axial image is important for planning the sagittal. So you have to make sure that the slices are perpendicular to the elbow joint or parallel to the elbow joint. So I am changing the fat suppression technique to spare because spare is more strong fat suppression technique. And then click apply. I am using the iPad mode to reduce the scan time. So that's it. Thanks for watching. Hope you like this video and learn something. If you do, please hit the like button and don't forget to subscribe my YouTube channel and wait for the third part of this tutorial. Thank you.